Researchers who forecast the impact of the pandemic here in North Texas now estimate the peak of the Omicron surge won't happen until the end of January.
Right now, about 1 in 3 COVID tests in the state are coming back positive. That's up from about 1 in 4 just last week. The number of virus patients in North Texas hospitals is more than 2,200, which is the highest since the October Delta surge. And the federal government will be providing additional testing sites in Dallas and Tarrant County. Fox 4's Stephen Dial has more details on all of these updates tonight. Stephen.
Good evening, Steve. The COVID positivity rate in Texas is the highest it's been this pandemic. And while the Omicron variant, which is more contagious, is less deadly, health officials say the vaccine is the only thing preventing people really from having to go to the hospital or even dying from the virus. It's a new year, but the storyline is similar. The coronavirus is not going away, and we are in the midst of an Omicron variant surge. Texas has a 33.9% positivity rate, a pandemic high. North Texas hospitals have the most COVID patients since October. UT Southwestern researchers who forecast COVID impacts are pushing the Omicron peak in our area from mid-January to the end of the month.
Clearly, I think January is going to be tough for a variety of reasons. First, just the sheer number of people who are getting ill.
Dr. Prathit Kulkarni is an assistant professor of infectious diseases at Baylor College of Medicine. He says while Omicron is spreading like wildfire, it's important to not only focus on the cases.
Case counts are a trickier metric to follow now. Obviously, the numbers are astronomically high across the United States. It's partially related to the volume of tests being done.
Last week, Governor Greg Abbott called on FEMA to open federal testing sites in Texas. The request from the governor also called for more staffing and treatment resources. Monday, FEMA approved 6 testing sites, 2 of which will be in Dallas and Tarrant counties. The Department of State Health Services confirmed those locations should open sometime next week. The workforce is also starting to feel the impact. Recently, Dr. Anthony Fauci admitted the government's change in recommendations for isolation time from 10 to 5 days for virus-infected people was made in part to get people back to work sooner. Kulkarni says more cases are impacting more than just healthcare workers being out of the office.
But also other sectors of society that we need to be running can be impacted if a large number of people not necessarily end up in the hospital, but still have an illness that keeps them out of work for a significant number of days.
While early studies show Omicron is less deadly, the unvaccinated remain at a greater risk. The SHS data from fall of 2021, before Omicron, shows that unvaccinated people in Texas are 20 times more likely to die from COVID.
You may end up with natural immunity after the infection, but you're taking a big risk sort of doing that, especially if you're older, especially if you have medical problems and things like that. So I wouldn't sort of put somebody's eggs in the basket of, well, let me rely on natural immunity.
The Department of State Health Services today also told me some of the other requests that Governor Abbott had in the form of monoclonal antibody treatments and more staffing. They said those types of things will take a little longer to get an answer for. They should get an answer for the antibody treatments later this week.